Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our coffee chat. Today our guest is Craig Ford, Vice President of Pharmacy Markets for LexisNexis Risk Solutions Healthcare Group. Craig, great to have you with us.
Thank you. Thanks, Jeff. Appreciate it.
You and I were just at the NACDS Total Store Expo, and one of the main topics was technology and particularly AI and their impact on the business. Maybe you could tell us how you see your services in the broader technology field impacting healthcare.
Oh, it was good. It was a good session. Like many of us, that was probably our 25th or 30th NACDS. And what I really noticed this year, more so any in the past, is a lot of entities, a lot of strategic companies on the floor exhibiting with the concept of patient engagement, incurring patient engagement, expanding patient engagement, and how do we get out to the right people, to the right patients to deliver better care, what have you. So that's outside of what we traditionally do at LexisNexis Risk. And our healthcare group primarily works within pharmacy, payer, provider, and life sciences, but the pharmacy world that I oversee has been involved with a lot of these chains, probably about 80 to 90% of these folks we work with from a compliance perspective. So risk mitigation, how do we actually deliver insights and enable our clients to be more efficient and to ensure that they are filling prescriptions for those docs that are able to write those prescriptions. So we are in workflow. We see that's our focus. We do a lot of workflow validations on the prescriber front. But what we really noticed this year outside of that core business are a lot of entities looking at how to be more efficient with their patients, how to contact the right patients, how to communicate the right messaging to their patients, what have you. So a lot of our discussions follow that talk track, which is perfect for the next phase of our business outside of prescriber, now focusing a lot on the patient front, the whole person front.
Maybe you could talk a little bit about how you're benefiting operational efficiency in the pharmacies,
Sure.
I guess particularly by connecting them to the payers.
Sure. Well, time is money, right? And anybody that works for any pharmacy will tell you that. How can we ensure our pharmacists and our pharmacy techs are having that consultation, doing their job? So what we try to do, we act as the enabler. So we do what we can to add greater efficiencies to the process. If you talk to any of the leading chains, national, regional chains across the country right now, how can we be more efficient and be more productive? So what we try to do within workflow is enable that process to be clean as possible. So the cleaner the data, the better the data, the more current the data from a compliance perspective, then that pharmacy can fill scripts, feel comfortable that they're delivering, dispensing scripts for valid prescribers. So that's step one. Step two, and we're going to talk about this a little more, and we mentioned earlier, is the patient front. So we're doing a lot of work with our clients right now, enabling them to ensure their patient profiles are clean, accurate, up to date. The first thing we do is we dedupe a lot of the bad data. So that's been a huge push, a huge focus of ours and our clients, I'd say the last 18 to 24 months.
And how do those services you provide translate into better patient care, better patient experience in the pharmacy?
Well, the first step is getting to the right person and getting to the right person in a more efficient means. As simple as that sounds, that has to be done initially up front, or some of these engagement programs just aren't going to add greater value. So the first thing we do is ensure that our clients are reaching out to the right people, to the right patients, and they're doing that in the most efficient manner. So that's step one, and a lot of people oversee that, and that's a huge part of this process. And then after we do that, we just maintain current contact information and deliver that on an ongoing basis with our clients.
You guys are also involved in population health. How do those data and insights affect what happens at the pharmacy counter?
When you look at patient engagement and the life cycle of a given patient, it starts with portal security, and I'm sidetracking just a bit, but once the right patient gets through to the portal, gets online with that given entity, they validate identity. We do a lot of authentication and validation and verification from that perspective. So once the right people have access, that's really when things start. From there, we can help our clients with various types of information. We can help link different social drivers, for example, from an SDOH perspective to those individuals. We help them really, I don't want to say target, but we help them actually assign different variables. One is transportation, and a lot of the conversations we're having right now is, can you help us identify patients, customers, consumers, what have you, that might be out in suburban areas that don't have access to care, or don't have access to a pharmacy as they did once before. So transportation may be a social driver, where they live, some demographics, some financial data, what have you. That all helps us, helps our clients, I should say, target those individuals to deliver their care in a more efficient manner.
How can pharmacies and other healthcare providers take the wealth of data that they have and translate that into personalized care?
It's something that we continually work on a daily basis. It's very difficult. We, like I said earlier, we consider ourselves an enabler. It's very difficult for a lot of these folks, a lot of our clients, in which to do that unless they have accurate, clean, current data. We have access to a lot of public records data. The data assets are immense, and it doesn't mean much unless you can deliver that and activate that in a valuable fashion. So what we try and do is establish success criteria right off the bat. What's our objective? What's our goals? We're on site with a lot of our clients on a very frequent basis. If you don't establish that plan and adhere to it, you're going to see it go by the wayside. We've seen it. A lot of our clients have seen that. So the most important thing is to be aligned with your objectives and your goals. It sounds simple, but it is number one. And then from there, ensure that that data can be digested on the other end. We can deliver it all day long, but if it's not digested and put into an actionable format, it doesn't help anybody, and we're not delivering value to our clients and then to the end user, the person that we're trying to benefit the most, the consumer, the patient. So I would say ensuring the right information is being delivered and you have a game plan for exactly how you're going to use it, and then follow up to make sure you're tracking your objectives on a most frequent basis. But it's purely a partnership. We definitely don't want to deliver data and walk away, or insights, what have you. It's a partnership, it's an alignment, and that's key. That's number one.
Thank you, Craig. It's been great to learn about what's going on at LexisNexis. Always good to see you.
Okay, thanks, Jeff. Appreciate it.